Today's webinar will give you insight as to why it's important to include community and research participants in all aspects of the work and provide strategies that will allow you to change the way you conduct research and incorporate dissemination into your studies and into your budget. So first, we will introduce our lovely panelists. And if our panelists can answer the question, introduce yourselves, where you work, why you do the work that you do, and why is this topic important, and why is it a forgotten piece of research from an academic and a community perspective. And either of you can go first.
You want to go, Britt?
I'll let you go first, Brandi.
Okay. So I'm Brandi Gates-Burgess. I am a lactation consultant. I have a nonprofit, as you can see, Breast Friends Lactation Support Services, where we support Black women throughout their pregnancies, offering breastfeeding education and support, also in-home and lots of community support for lactation groups and support and things of that nature. I also have over 17 years of working at WIC as the WIC director and program manager there. And then I work at Highland Hospital as well in Oakland. And I'm a mother of 4 beautiful children ranging from 18 to 3. And I'm excited to be here today. I also do community engagement with the UCSF Milk Research Lab underneath Dr. I do. So what brings me to this work is I love community. I'm a part of community. I feel that our voices should be heard. And that there's so much wealth and resources and connection in community. And as we engage with academic researchers, oftentimes the relationship can feel one-sided. It can feel like academia is oftentimes just taking from community and not getting back. And so as in community engagement specialists and recruitment, one of the things that we really focus on and highlight that we want to spotlight is how to really not only use your community, but also, share in partnership, share relationship, and build that trust so that it's not just a one-sided relationship.
Thank you, Brandi.
Hi, everyone. I just want to extend gratitude for the invitation to be in conversation with one of my favorite people about this topic. My name is Dr. Brittany Chambers-Butcher. I am an assistant professor at UC Davis. I did start my career off at UCSF. I do have a PhD in community health. And the reason why I actually have come to this work or to even an academic setting is because I wanted something different for my community. I was a teen mother and I navigated through the healthcare system and experienced several challenges and complications. And I just didn't want that to be other people's experience. And so I really bring to this work my own personal experience. I consider myself a part of the community. I do also recognize that through my training that, I am at times, not what the community is currently doing, how they currently think in this time. And so all the work that I do is super important to do it in partnership with community to make sure that what I am producing or what I feel like is worthy of investigating is something that they feel like will be impactful, something that they feel like will actually, change the issue that I'm interested in, and it's really advancing Black maternal health. I do feel like from a research perspective that this is a piece that's often forgotten. I don't feel like I was trained, even in getting my PhD in community health, on how do you actually include community members throughout the entire research process. I feel like you're usually taught hey, you get the participants, you get the data. Once you get the data, you're kind of done, and you kind of work on getting your publications. And so I feel like it's not something that we're typically taught to do, but when you're out doing the work, you like feel like, this doesn't feel right. It feels like I should be doing something different.
Thank you. Thank you both so much for that. So now we'll get into the juicy stuff and things that you can really take away and incorporate into your research. So in community-based participatory research, it's crucial to anchor yourself in your purpose, shifting from more of a product-driven approach to one centered on community, sustainability, and action. So as you embark on community-based research, it's essential to consider who is the intended community for your research and what drives your commitment to them. So given this, what advice do you have for researchers? How should researchers at academic institutions shift from more of a product-driven, which the product is the kind of the results of the research approach, to one centered on community needs, action, and sustainability?
I think you should go first, and then.
Okay. I feel like this is such a great question, and it does kind of tie on to like the comment that I was just talking about. But I do just want to highlight, I was able to come to UCSF as a postdoctoral scholar with the Preterm Birth Initiative, and I am so grateful for the time that I was able to be there under the mentorship of Dr. Monica McLemore. And they have coined this process called research prioritization for affected communities. It was a process that was led by Dr. Linda Frank, Dr. Monica McLemore, and Chanel Williams. And it really was one of the first time that I've seen an initiative, before getting everything started, create a research method where they go and talk to community members to say, hey, we're starting this initiative around preterm birth. What should we focus on? What are some questions that are important, to the community? And that is a process that I have used several phases throughout, my studies, all the way from policy recommendations. When studies change, we don't always do things like we write a grant and then something may happen, we shift the grant. And so in that shift, how do we always go back and check in with community? And so I would just highly recommend that, if you're not aware of that protocol, I'll drop it in the chat as well, Research Prioritization for Affected Communities. It is a great publication, as in the appendix is thick. So it has all of the templates for you. It walks you through the process of how it should be done. And we've continued to do this work throughout the pandemic as we've been shifting, and community members really do enjoy engaging in this, partnership. I feel like Brandi mentions in the work that we work together as well, is that we all bring our own wisdom to this space. And when you're doing something such as having a prioritization session with communities, you're allowing people to stand in their strengths and work together to develop some questions that we feel are important for our communities. It also allows opportunity for us as researchers, if there's a question that community has, that we're to say, hey, this question has been answered, and we're able to give them that access and that information. So I would definitely recommend that particular approach. And most recently, through a collaboration that's taken place between UC Davis, UCSF, and UC Berkeley, we are actually formalizing a community research model where we are really saying, hey, in order to do this work in the right way, that our community members are partners, they are long-term partners, they are with us as we're writing the grants, they are with us as we are developing curriculums, as we're developing studies. And it doesn't mean that it is going to be easy, right? And what I mean by that is that we all operate on timelines. We just do. And sometimes doing community work is saying that you have to let that timeline go And you have to say, okay, my community partner is saying that this is important to me. How do I slow down? Because we kind of make the timelines for ourselves anyway. There are mechanisms for us within grants to say, hey, I need to have an extension for X, Y, and Z. And so just keeping all that in mind, and not necessarily, I felt like I was always running on a treadmill when I first joined academia, because I'm like, I have to meet this deadline. I have to meet this deadline, but I want to get this done. I want to do this right. And now I'm almost at this place where I'm like, okay, let me slow down this treadmill. Let me take some time to check in with community partners, because I don't want to produce something that they're not proud about, or that what people recently told me, that they don't feel like they see themselves in this work, but we have them on our websites, we have them on our flyers. And so I feel like in order for us to really think about how do we put community members throughout the process, particularly in the dissemination work, it requires us sitting down and asking them, well, what should we do? Like, how should we disseminate this data? Most times they won't say a research article. That's what we want, right? That's what we need also, right, for promotion. But it's also like, how can we do an infographic? How can we do an event? How can we make sure that we are producing things for all of our audiences, right? Because we do it when we write a publication. We like, okay, we need to talk to this policymaker about this. So we tailor that for that policymaker. How can we continue to prioritize our community partners in this work, which does require us actually sitting down and having a conversation with them about what do they think and what's the best way for us to do this.
And I just want to add, like, before we get to all of that, you got to take a step back. Like, if you are thinking about studying a community, regardless what it is, if it's Black mothers, if it's people with asthma, if it's, whatever, you have to find out who the key players are in that community, who's already doing the work, because there's no sense in you as a researcher starting over from scratch. There's somebody that's already in the community that cares about their community, that's been affected by whatever it could be that you're thinking about, that's already doing the work, right? Or that's a champion for, their child that may have autism, right? And so, or whatever the problem is. And so they're already doing the work. They've done research. They've maybe started a group, or started trying to make change at their doctor's office. And so we as community, like in our cabs in different areas, we always say the solution is in the community. The answer that you already are trying to study is already in the community. We may not have the funding to like push it forward, or we may not have the resources, but we've already thought about it, kind of laid out a plan, and are trying to make it, put it in action and put it into place, and to create policy change. And I think that's where the true partnership really happens, is like finding those key players, finding those champions, finding, the groups or the people who are already doing the work. And now you're bringing the academic and the research and like studying it and showing the data, showing, bringing the analysis of like, it's true what they're saying, and here's the data how to back it up, right? And so that's how I think there's true partnership that's built. And it's not just a take, or it's not just I'm coming to study this and now I have my data that I've collected and I can write my paper. It's also, I've partnered with this person or with this group or with this organization, and yes, I have the data, but we've also come up with a solution or intervention to help XYZ problem. And I think, that's how you build trust, you build relationship, and you continue to have that partnership. So if you ever need to go back, or you feel like, okay, now we want to, we've thought about this intervention, now let's put the intervention into practice, right? It's a way that you always continue to just have that relationship without just it feeling like, these white people came in and studied us, took our information, took our knowledge, took our samples of our whatever, and never told us anything about it. And yet we're still in the community with whatever problem, we still had. So I just wanted to add that part, because I think that's a big part that a lot of researchers tend to not consider, as they're thinking of ideas and research projects and proposals, how to really build that partnership first with their community.
Yeah, thank you both so much for that. It definitely goes back to the why. Why are you doing it? How are you able to connect with community beyond just the research? And how are you able to come back and continue and sustain that relationship? So yeah, thank you so much for that. So in terms of the next question, so some common challenges and barriers to community collaborative dissemination processes researchers have shared are one, lack of knowledge to include community members in the dissemination process, no desire to include community members in the dissemination process, lack of time. So Brittany, you spoke about this in terms of really tight, steady timelines. Another piece is authorship guidelines and authorship limitations for certain journal outlets. And lastly, no resources to pay community members to participate in dissemination. So how have you been able to overcome these barriers in your research processes? Feel free to give us some examples of dissemination tactics that you've used. And then how do researchers prioritize dissemination into their budget? I think that's a really big one. What should they budget for? And then include some examples and ideas when funds are not available.
I would just like to say, to start off, is that you as researchers cannot do this work without us. You cannot do research without, study participants, community orgs, real people. Like, unless you're studying animals and rats and stuff, you need your community. And so the process should be like, I have to value, right, the wealth and the knowledge, the lived experience that is coming from this project that I'm going to do. Like, there has to be a prioritization and a value of the lived experience. And I think oftentimes that's forgot about. I say this a lot in a lot of the spaces that I sit in. Like, there's this gloomy cover over community is like, they're just, low income, people who are on welfare, or, have, that live in, the hood without any resources or without any education. And that's not necessarily true. There are those people who fit that criteria, but there's so much wealth and knowledge. There's doctors and lawyers and, college educated folks. And, there's so many different people that are in community that are there, and their lived experience is valuable. Speaking as a Black woman, the maternal health crisis for Black women, it crosses all social economic spans. It doesn't matter your income, your age, or what you do, where you live. You can still be at risk to have preterm birth. You can still be at risk to die 3 to 4 times more than a white person. And so those things doesn't matter, and it doesn't really matter where you live, right? And so when you're taking those things into consideration, when you're thinking about that lived experience that is so valuable to your work, you have to show community that is valuable to them as well. And I think that's where a lot of the mistrust comes from, because we're like, well, you can't give us anything, but yet you're taking it and, making money and paying for whatever you have to pay for within, your budgets and things like that. But then you give someone like a $25 gift card, for an hour of their time, and they may make more money at their job that they could be taking, away from their time or away from their children, and you're not compensating them, what their lived experience is worth, and what you could future, what's the word I'm looking for? Like, not capitalize, but you're getting money too. You're getting money from it. and you're only giving them like a tip of what you could possibly, and that's not okay. It's not equitable. And if you're really saying like, I need, this is a part of what makes my project and my research and my work do what it does, you got to show that in the front. It has to be prioritized as you're creating your budget. It can't be the last thing. Now you're like, oh, wow, maybe I can, piece together, $500. It's not, yeah, it's just not okay. And sorry if I took too long.
I feel like you highlighted some good things there. I would say, so first of all, full disclosure, I love throwing events, y'all. So like throwing a dissemination event is my jam, is my thing. I look forward to it. I do feel like I don't always have the budget that I desire to really bring to life the way that, you know, we as in myself and community partners would love to disseminate the findings. But I feel like research is hard for one, and that we should celebrate every win that we have, right? And it's a win to be able to partner with community to reach our recruitment goals, to reach, if it's not recruitment, to reach the goals of the actual study, and to celebrate with community, to share that information back with community. I do know though, after getting grants, that a lot of grants don't have budget for that. Things that I have done, and I would give this to Dr. Kirsten Biggins Domingo, who really told me this early on, is like, you kind of get different funding to fund different pieces of the work. And so, if I really need to pay participants well for a study, right? Not focusing on that $25, but trying to give them the $100, and I have a $25,000 grant, I need to think about, well, what opportunities are available for me to apply to disseminate these findings. And so I have been kind of breaking it up in different grants to kind of do that. I'm fortunate to be a part of a study, not SPI yet, but I'm calling into existence to have my first PCORI grant soon. But being able to be on it as a co-investigator, I do know that there are some dissemination funds there, and there are actual institutions, grant making institutions that value community partnerships, that actually provide funding for that. And they do a great job to ask me, well, how are you going to do this? How are you going to make sure you're accountable to community, and wanting you to outline, all of those things. But I would say, if you're like early in your journey and you're really trying to do this, I would just highly recommend like whoever you're partnering with to help with recruitment. And I would say I do this across the board, right? It doesn't matter who I'm interested in, studying in, and that's in the particular study. And I've had different people in groups, like they are your community. So whether it is you're out looking for community members, you're out looking for providers, whoever you are wanting to engage to learn something new, novel in the field, they do deserve to hear back from you about what you've done with the work, and how you're sharing the data. But I feel like here at UCSF, we have different ways we can do that. Well, I'm not there anymore. Sorry, I'm still holding on to that past. But at UCSF, you can do that through grand rounds, right? Like you have an opportunity to give a grand rounds. I feel like the Preterm Birth Initiative was really great at it. When I kind of came on with the, collaboratories that were created for community and academic partners to kind of share that space and to do something. Like here today, we, intentionally, I feel like Helen brought us together to where we're having this cross communication, and Brandi and I have had the opportunity to work together on projects. And so there are ways, like I feel like sometimes people think like, oh, dissemination is something hecka big, it has to be something hella crazy. But like literally, if you don't have a budget, it's just like, okay, how can I pay community, $150 for an hour to talk with me about how can I turn my research findings into an infographic? That's the bare minimum, right? And then the next phase is like, if you got little money, I recommend you do an event, because it'd be nice to have like a share bag, and the community can kind of come with you like, well, this is how we think this should be presented. This is the music, this is the vibe, this is the setting. This is how we want to celebrate this win with you. But I feel like there's this spectrum, right? Just like there's a spectrum of participation, there's a spectrum of like, how do we disseminate things? What can we do? And I just want to challenge people to think about that in your work. Just what is one way that you can actually, give back to community, because they don't read research articles, right? I can barely read all my colleagues' research articles, right? We're all in different fields. It's very challenging. Most journals are now incorporating highlights, but it's just the bare minimum of how can you share back to community who you're working with, to your study participants, to say, hey, I value you. Hey, I collected this data and this is what we found out about it. And literally what I found across my studies is people really appreciate that, because they said that people don't do it. It never happened. And I feel like one thing that really sticks with me the first time that we really did this, and it was actually a collaboration between me, Helen, and Brandi, and a few other people, is community members didn't know that people actually cared about them, about their study, about their stories, about their children. And, that's what we're trying to do in this work. We're all in this work because we care about people. We want to see some change, and we want the people who we're collecting data from to feel valued, to feel seen, and feel heard. And in order for us to do that, we have to do a better job at disseminating these findings so people don't feel like we're just parachuting in and parachuting out, because it does leave some bad stuff for the rest of us. When we come to the community, we spend 6 months trying to build relationships and try to heal some harm that's been done by colleagues who came from similar institutions.
And I just want to highlight too that when we are disseminating our information and our data, that we're using language that resonates with community, that they can understand, that is familiar to them, and that they're involved in it, that, that they're, I strongly feel that if you participated in a research study, that you should be, invited, even if they don't come to whatever your choice of dissemination is going to be, they should be invited. An email should be sent with like the infographic of like, this is what, you helped us come up with. And even doing like a focus group on, hey, this is the infographic that we've come up with, or this is a toolkit that we've come up with. What are your thoughts? How you feel about the language? How do you feel about the pictures? Can we change anything? Like really making sure that they're involved in every step of the process, because you may think you're getting it right, and it could not be as right as you think it is. And so I just wanted to highlight that, to making sure you're using language and imagery and things that, the community could use and need, and that they would like to share with other people who may, be in a similar situation, or who may need the resource in the future.
Yeah. Thank you both so much for that. So we're coming up on our last question, and then we want to definitely leave some room for questions and comments. So for the last question, considering your diverse academic backgrounds, why is it essential for researchers to prioritize and include research participants and the communities in which they conduct research? Could you provide insights into effective ways researchers can actively involve communities in this process? And can you share practical examples of such inclusion looks like? You guys have definitely highlighted this, but if you can highlight more, or maybe specific examples of studies that you've worked on, and what that process looked like. What was your thought process in terms of, I know you guys talked about focus groups, and kind of sharing back the data from the focus group and making sure that that aligned with a specific community that you were researching. What did that process look like? How did you come to that? And maybe even talking more about like dissemination events. Like, what does that really look like? What are actual figures and numbers for people who are here today looking to maybe wanting to do a dissemination event? It doesn't have to be super expensive. Of course, if we have like $1 million budget, that's always great. But if we don't, and most times we don't, what does that look like? You know, are we ordering food? I know in the past we've ordered t-shirts. So we do all like to go all out. So if, you know, what does that look like from going all out to, you know, kind of something smaller and more tangible?
Yeah. One of the things I think I'm so grateful to Dr. Ifeanyi is when she created her the UCSF Milk Research Lab. One of the things that was very important, it was for her to create a position to have a community engagement resource community researcher on her team. And so I think that if you all are going to continue to do work with community, you know, that's one of your biggest focuses, is to just build that into your team, because you're going to utilize them. Anytime, like I do help her with recruitment. So when she's doing new studies, when she wants to do focus groups, events, survey, like I'm in working with her. You know, I go to monthly staff meetings. I do everything from looking at what, you know, the survey questions are, if they're going to resonate with community, you know, what it maybe if the language is too scientific or research, you know, how can we change it so that it's, you know, average person can understand it. I look at flyers for, you know, her recruitment, like, what is this going to resonate with folks? Like, there's so many ways that we could be utilized. And just adding them onto your team is just it, you know, that way you don't have to keep looking for people to partner with. You already have your community engagement person, and then they could shed light on anything. And then if you need to bring other community partners in, you're always able to do that. And your community engagement specialist is oftentimes already tapped in with the community they're serving, so they already have some connections, you know, to different people, you know, in the community as well. So it's just a really good relationship. I also think teaching them about research. I know when I partnered with Dr. Chambers, she taught me a lot about how to be a community researcher, about coding, about putting things into the domains, and understanding how to like go back and look at the data. And I think that's a really big part, is it's like you're giving as well. You're giving community, you know, skills so that, you know, and opportunity. And who knows, you might change someone's life and they might want to become a researcher. You know, we need more people of color in the research field. So I think that's one of the keys, that takeaways and things that I really like about working with Dr. Brittany and Dr. Asiadu is that they're involving community into their team. And so they just always have that community perspective on hand. I also just want to highlight one of the projects that me and Dr. Brittany did together when we were recruiting for Solars, and we had that big dissemination event in the park. And we had so many community moms come out who either were interested in doing the study or have participated, but we celebrated them, their pregnancies. We let them know kind of where we were with the research project, how it was going, what else we needed. And it was a way to also do recruitment and, you know, stay in communication with community and like show them the face, right? Like, I'm a real person, I'm personable. You know, it wasn't like a big scary thing like this researcher, you know, whatever stereotypes that are in people's heads about it. It was a real chance for people to engage and connect with Dr. Brittany. So I really think that if you could do a community event where you're able to go out and meet, you know, the study participants, not just on a Zoom screen or, you know, sending an email from your, you know, it's like they get to know you and get to trust you. And I think it's a beautiful thing.
I just have a few things to add to that. I also do have a community member who's a part of my team as like a contract employee. But there's different ways, right, that you can engage community. And I feel like having different ways to do it. Someone may want to be a community researcher. They want to be maybe a community advisory or accountability partner. So people may have different capacities and wants to be on your team to engage. But having events that includes the culture and history of your study participants. So if you're doing a share back event, just how are you making sure that you are doing that as you are prioritizing community. I also have done working groups with community members as we're developing papers, and so including community in the writing process of like, hey, this is what it looks like to write a journal article. How can we workshop and be in groups together to really work on this particular piece. And we've also are currently like developing curriculums. We've developed tools with community, just developed a healing toolkit with community partners. And again, it's like workshopping it. Like, I feel like it's like, how do these two worlds come together? Like someone has this idea and then it's like, okay, y'all, we brainstormed this. Let me work with it. Let me bring it back and see like, how is this working? How is this going? But every time I take community members with me to conferences, and I've done it a few times, they always say no one takes them to the conference. And so I'm going to tell y'all, take y'all community partners to the conference. Co-present with your community partners. They are valuable just like we are valuable, and like having them see all pieces of the research process is super, super important. So those are things that I leave, but I appreciated this conversation.
Thank you both so much. I know we're at time, so we want to open it up for everyone, the audience, to ask questions or to make any comments. So feel free to unmute yourself and ask a question, or you can put it in the chat and I can read it out loud. We have about 9 minutes. No questions. Everybody's perfected the subject matter. Well, I'll read a question from Roberto. He had a question before he left. He said, let's see. He says, this presentation is music to my ears. Thank you so much for saying all of this. Translating our findings into action has been one of the most challenging steps for teams I've been on, even though we have done it with some great impact. Can you please share any examples you may have of translating findings into change in policy or community health approaches?
Yeah, so I'd say from the work that the study that Brandi's talking about, and yeah, it was a banging event, I will say. We were able to use the research prioritization method to prioritize areas within each domain. We're also invited to go to the state to kind of speak about this. Our data has been cited and used for bills such as SB 464. And our work, continues to, be used in different spaces. Because what we find is that community voice is really powerful. Bringing experiences to numbers is really do move policymakers. And so we've been able to really be invited to share that work at a larger scale.
And I think for me, we created a NICU toolkit from one of our research studies that is a resource for Black moms who have had a baby in the NICU, or have recently had a NICU experience. It has so much information about like the language doctors may use while they're in the NICU, about the importance of breastfeeding and offering donor human milk. It also has community resources for like breastfeeding support, mental health, and other policy, how to get involved in policy change. And one of the cool things is that Alameda County Public Health Department actually downloaded and printed a few hundred of the toolkits to give to members of the Black Infant Health Program and of the Beloved Birth Program that focuses on Black pregnant and postpartum women. So that was really exciting to see something that we study Black women in the NICU, and then we created a toolkit, and now they're utilizing it in different community programs.
That's really amazing. I love to hear that, Brandi. We have a question from Madeline.
Hey there. Hi, Brittany. Hi, Brandi. Thank you so much for talking about this. I work with early career investigators, including Brittany, who's been a member of the Case Scholar Program for many years. And I wanted to just kind of comment on the treadmill article or comment that Brittany made, which I completely understand. And it seems to me that faculty get on this treadmill and they're so geared toward promotion and getting forward and getting the next grant and getting promoted to the next level that I feel like community engagement should be embedded in the evaluation process for faculty. Like, you can't move forward unless you've engaged with the community, unless you've disseminated your work, right? Because otherwise none of this is really worth it unless we reach back to the people that we're affecting. So that's my plug. I really feel like we have to change the academy in that way. And it's not all about the individual, it's about the community at large. So
thank you for that, Madeline, because
You're
I thought,
welcome.
what are you doing it for if the people never get to benefit from it? Yeah.
I agree with that comment. I was like, and I know you have some power to make that happen.
Oh, do I?
Yeah.
Okay.
All right. I'll do my best.
Okay.
Thank you for that. Is it Jackie?
Hi, it's Jock.
Oh,
Hi,
sorry,
everyone.
Jock.
No problem. Hi, I'm a coordinator at UCSF Neurology at the Movement Disorders Division. So we predominantly work with research based on Parkinson's and other movement disorders. I just want to thank you all for kind of sharing your insight. And we're curious. We are starting to do a little bit more community outreach, and of course, very unsurprisingly, Black people are sort of just very underengaged, particularly among this group. What do you suggest would be the first step in terms of trying to identify that community leader or that community engager who's already doing the work, so to speak, so that we're not, entirely reinventing the wheel? We kind of are just now getting into this. We've done a lot of community outreach in terms of just reaching support groups, but again, we're hoping to see if we can, engage some groups that we haven't been able to engage with yet. So what will be your suggestion in terms of first steps in identifying those types of people?
Mm-hmm. I definitely thinking if you are doing a support group, or if you have connection with the providers that serve these people, to ask them, who we're looking for this, who do you, out of your patient load, or if you go to one of the support groups and you see someone who's really active and they're encouraging others and empowering and they're sharing their lived experience, like, that is your champion. That is the person that you may want to offer an opportunity to. Also putting it out there, the way that I got into the community advisory board was, they have flyers up around community just saying, if you're this, if you're that, if you meet these criteria and you're interested in, learning more and, being an active voice in research and, whatever key phrases you want to use, the person who is called to that it's like a connection from the Most High. Like, y'all gonna be put together. And I think that that's one of the biggest things. It's like putting it out there. Like, we're looking for people who have this, that, blah, 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 blah. If they meet that, then, invite them in, maybe do an interview process or have them fill out a survey, seeing if they're interested. And if they say, yeah, there you go. I think that's, a great way to start is just looking already in the support group or with the doctors, or, looking for that community champion, in places that they may be.
And I would say one thing too that I noticed is like, what do your recruitment materials look like? And did you partner with community for those? And I wish I had an example right now, but I have this slide of like before I talk with community and then after I talk to community of how the flyer has transformed, and it is all like close to shameful. So that would just be one more thing to add at.
Okay, thank you both.
Thank you. I know we have like 1 more minute. We do have one last question in the chat from Yuri. The question is for Brandi. What's something you know now about partnering with researchers that you wish you'd known before you first partnered, or that you think other community partners should know before they get into their first partnership with a researcher?
I think that they should know that researchers aren't necessarily connected with community as they should. So it's going to be like a learning curve on that part. But I also think it's a learning curve on both ways, because I don't think I knew how much I was going to actually love and learn about research, being a part of this work. And I also think that other community partners should understand that, that there is a big time commitment. Like sometimes people say, oh, it's only 5 to 10 hours a week. But sometimes you can spend way more time than that, especially if it's something that you really are passionate about and want to create change. So just the time commitment, how much you're going to learn, how much the researcher is going to learn, and to always be themselves, like no matter what, because that authentic voice is what is needed. You may not always know how to say it, professionally, or in the right way, but just being able to have just that relationship where you could be yourself authentically with your research partner is like a key to a successful relationship as a community partner and a researcher.
Well, thank you so much. We're at time. I really want to appreciate and thank Brittany and Brandi so much. It's always so good to be in collaboration with you both, because you know how much I love you guys. And also thank you so much for everyone who attended this webinar and who stayed on the full time. We are greatly appreciated, and I hope you were able to really take some key things from this and hopefully be able to incorporate it into your research studies going forward.